Well, today we've got Dr. Shweta to talk to us on nutrition. It's so kind of you to come, Doctor. Whereabouts are you in this world?
Hello, pardon?
Yeah, whereabouts are you, Dr. Shweta?
I'm from Raipur, Chhattisgarh.
Is that in India?
Yes. From India, Raipur, Chhattisgarh.
Okay.
Yes.
Yeah. Now, are you seeing? So you're in central India, basically, aren't you, at the moment?
Yes, I'm in central India.
Now, are you seeing a lot of effects of COVID disease in that area?
Yes. Now cases are increasing in our area. Initially, cases were less, but when trains and buses and all communication started, so now cases are increasing in our state also.
Right. So things closed down, and that kept a lid on cases, but now you're seeing more cases coming.
Yes. Because lockdown is there, so people are communicating here and there.
Yeah. Are you seeing more people that are actually getting sick? Are you seeing more people come into hospital?
Yes.
Right. So there's more people actually symptomatic and ill now requiring treatment.
Yeah. Mostly right now, mostly people are symptomatic, so they are
Right.
going for the test and then they are getting positive results.
So there's testing available now.
Yeah. It's easily available.
Okay, right, yeah. Now, how do you see that trend going? Do you think the cases are going to become less in the next few weeks, or do you think it's going to become more in the next few weeks?
So see, now in India it's monsoon season, so usually people get more cold and flu in normal scenario, I'm telling you. So with COVID-19, it's more serious situation that people will not be able to judge whether it is normal cold or fever or flu or whether it is COVID-19. So in this monsoon, people have to take care of their nutrition, their immunity, their stamina with physical activity, with normal vitamin C, vitamin D supplements, and their daily diet routine. Then only we will be able to reduce the cases. In any way, the senior citizens are more prone to these diseases, and if people are having any metabolic diseases, so they are more prone to have these diseases. So they have to take care of these nutrition and most important social distancing and gathering places they have to avoid.
Is malnutrition a problem in India generally? I know you work particularly in nutrition. Do you see a lot of malnutrition in India or specific nutrients that are deficient?
Yeah. Malnutrition problem is common in India and majorly lower class people. But nowadays, people and NGOs and government, most of people are working on it. Mostly deficiency of proteins and iron.
Is there any particular reason why people in India are short of protein and iron?
Because mostly people are vegetarian.
I
So
see.
that's why protein deficiency, and they don't get enough protein with one katori of dal or pulses. And in daily basis, they use more of carbohydrates in place of protein. In their daily diet, if you see, it's more of carbohydrates compared to uh, proteins.
So carbohydrates are cheaper to buy than protein, so people fill themselves up with carbohydrates.
Yeah. They feel it's easy to cook, it's easily available, so they more prefer to eat carbs.
Yeah. How do you recognize protein deficiency? Do people develop edema?
See, for in kids, they don't have good growth, height,
It's
and
developmental problems.
yeah, hair fall, very common problem, and lethargic, tiredness easily. This is the equally symptom of hypothyroidism also, but in protein deficiency also we see this. And with this, iron deficiency is also very common.
What happens if someone's iron deficient? What disease do they get?
Uh, Dizziness, tiredness, and problem in their menstrual cycle with females.
Yeah. So
Yes.
they get iron deficiency anemia.
Yes, anemia. Normally, people are having 10.29. This hemoglobin level is very, very normal in India. Very less people are having 12 and 13. In female, I am talking.
So many women in India are chronically iron deficient and have iron deficiency anemia.
Yes. It's very common problem in India. So
and that will make them very tired, very short of breath.
Yeah, breathlessness and tiredness, giddiness, these all are symptoms of that.
How common is this? How many women in India do have iron deficiency anemia? Is it very common or just the odd case?
See, mostly when females are having irregular periods or PCOD, or when they are pregnant, usually at that time they get their test. So at that time, it's normally between 9 to 10, and then they tend to get their iron supplements. So most of the reasons are these, when females are having low iron levels, low hemoglobin levels.
So you can treat this quite easily by giving them iron tablets, iron supplements.
First, see, if someone is coming to me, so first I suggest all the food supplements by which we can increase their iron. If people is pregnant, female is pregnant, then only we will go for the supplement. In normal scenario, I will recommend diet supplements to increase the iron level and hemoglobin level. With that, we can easily increase their hemoglobin.
How long does it take to increase their hemoglobin once you increase the amount of iron that they take?
See, in nutrition, what we suggest, I can give you the example so people can take it on their daily basis. Green leafy vegetables are very good sources, and in Chhattisgarh, we have 36 to 40 types of variety green leafy vegetables, which are easily available in all seasons, and equally green leafy vegetables help to increase the immunity levels. Along with green leafy vegetables, I suggest dry raisins. We call it monakka, dry raisin, that can be soaked on the daily basis, like 6 to 7 dry raisins you can take daily in the morning. Dates are really good source of iron, dates. And along with that, jaggery and chana. That jaggery and peanuts is a good combination for iron. And
Peanuts.
Equally, peanuts, and equally jaggery and roasted chana, that grams, like grams, Bengal gram, that brown Bengal gram.
Okay, I don't know those, but that's fine. Yeah. So this is good. So rather than give iron supplements straight away, you recommend things that are available to people in their diet.
And one very good seed, garden cress seeds. 1 teaspoon, like 5 to 10 grams, you can have it daily to increase your hemoglobin. You can soak it in the water, or you can soak it in the milk overnight, and in the morning you can have it. It will increase your hemoglobin level in a month.
So what you're doing, rather than just giving people supplements, is you are training people to make the best of their environments, to promote their health, given the materials that are available round about them, rather than making them dependent on you.
No, I'm educating them that how you can keep fit yourself. I am educating and I am maintaining their health, that lifelong, how you can maintain it, how you can keep fit yourself. So by improving your iron, vitamin D, B12, protein, and weight, maintain your weight is equally important, because if you are obese, then you are tend to having so many metabolic diseases, and your immunity also will low if you are obese.
Yeah, I really like this approach, Dr. Shweta. I think you are training. So what 1 or 2 visits with you could improve someone's health for the rest of their life.
Yes.
No, that is excellent. So we've mentioned protein and iron. What other deficiencies are common in your practice?
More than deficiency. In deficiency, it's vitamin D, B12, and iron, and the other things are in excess, like high cholesterol levels are very common in India.
So people are eating the wrong foods.
And diabetes also, high sugar levels.
It is very common, yeah. So let's think about the vitamin D. Is vitamin D deficiency quite common in your practice?
Very, very common, very common. And people are not having any symptoms. So in general, whenever someone is coming to me, I always prescribe some tests that before giving any diet plan, I will check your few blood tests. Like I always check vitamin D, and most of the time it's low. Very few people are having it's more than 20. Most of the people are having is less than 20.
So most and that's nanograms. That's
Nanograms per milliliter. Yeah,
nanograms per
20
milliliter.
nanogram.
Yeah.
Yes.
So it's the American way. Yeah. So does like what's if people are low in vitamin D but they're not having any symptoms, does it matter?
Pardon?
If people are low on vitamin D, why is that important to know?
Because it's directly to related their bone health, and nowadays people are researching on that it's directly related to COVID-19 to improve their immunity. So with bone health, knee pain is very common in females plus 35. So if people are having knee pain, any arthritis or osteoporosis, then definitely I suggest to get their test for vitamin D. So then we can correlate why they are having these pains.
And most people that you test are low. The majority are low.
Yeah, majority is low, and people are having hypothyroidism. Again, hypothyroidism is very common. So people are having hypothyroidism. They are more tend to having low vitamin D, because people hypothyroidism absorb more of calcium.
Right, I see.
So they are tend to more vitamin D deficiency. So if someone is coming to me with hypothyroidism, then definitely I suggest to go for vitamin D test in every 6 months.
Right, okay. Now, so do you think low levels of vitamin D are going to compromise immunity as well?
Yeah, definitely. People will be having more cough and cold, and especially in weather changes.
So do you think if we were able to increase the vitamin D levels in everyone in India, that would mean that less people would die from COVID-19?
See, the normal RDA, what we call it, our recommended dietary allowances is that is 700 IU international units, but people don't take it that much. So why? Because in food supplement, if I talk about, then vitamin D is present in fish. Good amount is present in fish. And if non-vegetarian people are not eating fish on daily basis, in North India, means in Kerala, people are eating good amount of fish. Maybe in Goa, people are eating, but in North areas, people are more eating chicken and meat rather than fish. So they are having vitamin D deficiency. I just want to add that 100 grams of fish having 600, 500 IU, means 60% of your daily requirement. So you have to eat fish on the daily basis if you want to complete your vitamin D requirement on the daily basis. That is not possible. And the another good source is sunlight. So in India, people don't go in sunlight directly. And if some people are going, so 4 months they can get the sunlight, but in monsoon it is difficult to get sunlight. So the last option is supplements only.
Right. Okay.
Yes.
How much supplement do you prescribe? How many units would you prescribe for supplements?
See, from 19 years to 60 years, we can prescribe 1000 IU to 1500 IU per day, but for 2 months. Then again after 2 months, they should check their blood test. If it is in normal range, then they can stop taking supplementation.
So 1,000 a day for 2 months.
Yeah, yeah.
And then check again. Yeah. Okay, that's good. Yeah. So you also mentioned vitamin B12. Is that a problem in India?
What?
Vitamin B12, lack of vitamin B12.
Yeah. Vitamin B12 is again a common problem in India.
Well, why is that?
Because again, its main sources are non-veg.
Right. So it's mostly from animal sources. Yeah.
Yeah, most of animal sources. So people are not able to take it on their daily diet. So that's why vitamin B12 deficiency is very common. So again, we have to go for the supplements in that case, because for vitamin D, at least we can take sunlight that is easily available for everyone. So at least for 4 to 5 months, we get good sunlight, and the best time to take the sunlight is between 10 to 12 for minimum 15 minutes to 20 minutes. If someone is not liking the direct sunlight, they can use the gelatin paper. They can keep it and then they can take the sunlight. For kids, we can use the gelatin paper and then we can give sunlight to our kids.
What paper, Dr. Shweta?
What
paper did you say that you give? What paper?
It's a transparent polythene like gelatin. We call it gelatin.
And you eat it?
No. Not eat it. To take the sunlight, we use that. Because if you don't want direct sunlight on your body, then you can use that polythene so that your skin will not burn it. Because in India, in summer, sun rays are with very high frequency. So you can use it.
I see. So it stops the sunburn, but still allows the vitamin D production.
Yes.
Oh, I didn't know that. That's interesting, because we always teach that if you use sunscreens, protective sunscreen, that's going to stop you getting sunburn, but it's also going to stop you making vitamin D.
Yeah. So in naturopathy treatment, have you heard about naturopathy treatment?
Natural what?
Do you know? Naturopathy treatment.
Oh, naturopathy. No,
yes.
Tell us.
So in naturopathy centers, they give sun bath after putting this gelatin polythene.
Right. Just in the sun, just outside in the sun.
Yeah, right? Yeah. To just stop the sunburn.
Does that? Do they still produce vitamin D though?
Yes.
Fascinating. Right, I didn't know that. Thank you for that. Now, the vitamin B12, if vitamin B12 is deficient, can you take tablets?
Yeah, in tablets, and mostly people doctor prescribes injections for vitamin B12, weekly injection.
Yeah.
Or after 15 days. It depends upon their blood test, means how much are their ranges, below 200, below 100. So it depends upon their blood test. Accordingly, right. Doctors suggest. Because B12 usually we dietitians don't suggest, because mostly they give in injection form. So mostly doctors suggest vitamin B12 dosages.
Okay, yeah. So we can give it either orally or via injection, which is good.
Yes.
Yeah. So what I'd like to sort of concentrate on is that there's actually an emergency just now in India with COVID-19. It's getting more serious now. What dietary advice can we give people to try and increase their immunity? Sorry, did you catch that?
Hello.
Yeah. Hi, I'm here. We've lost her.
Hello. Can you hear me?
Yeah, I've got you. Sorry, I was drinking tea.
Sorry.
Yeah, I think we're back now. Yeah. So what I'm saying is there's an emergency in India now.
Yes,
Can we kind of summarize the advice to give people to promote their immunity, to make it less likely they get COVID-19 and to make it less likely they get serious disease?
So for COVID-19 and nutrition, you are asking that how we are educating the people. So in this scenario, as I was telling initially, that protein, vitamin C is very important, and zinc and vitamin D.
Drink lots of water.
And water and proper sleep. Water and sleep, usually people ignore it very easily. People take so many supplements. People are taking Zincovit. People are taking some vitamin C supplements. People are taking vitamin D also.
Yeah.
So, but they forget to take proper sleep and water intake.
Absolutely.
So, yeah. So, and how they are drinking water, it is equally important. They should not drink 1 liter water at one time. They should drink it sip, or like little bit of water in every 1 hour, so that their body will be hydrated and it will improve their immunity also, and it will improve their stamina. So minimum 2 to 3 liter water intake is very important per day for normal people. If they are suffering with kidney disorders or some other disorders, then we can discuss about the water intake. But in normal scenario, people can take at least 2 to 3 liter water on the daily basis. Equally, yoga and some physical activity is helping them a lot to improve their immunity. So it's 70 to 80% diet and 20 to 30% is physical activity, and at least 6 to 7 hours daily is very important.
How much?
6 to 7 hours.
Physical activity?
No. Sleep.
Oh, sorry. Yes, yeah. Oh, yeah. People just don't realize how important sleep is for immunity. So I love this. It's such simple things. So there's this dietary advice, there's sleep, water, and physical activity. These are simple things.
Yes. So these are the total combination of your complete health, your perfect health, rather we can say.
And this is without giving drugs. So this is excellent news. Yeah.
Yes. So, and if you are below 50, then with these things, and if you are not having any metabolic disorders, then definitely you can keep fit yourself just following these small tips.
That's good to know. How common is diabetes in India?
It's very, very common because, see, again, if people are malnourished in India, so equally obesity is increasing in India very much.
Right.
So if people are obese and they have history of diabetes in their family, like genetic history, and they don't have good lifestyle, means their sleeping pattern is not good and they are obese, then type 2 diabetes is very common.
And that's going to make people much more likely to get severe COVID disease, isn't it? Much more likely.
Yes. And if people are diabetic, so they are more prone to having this COVID-19.
Absolutely. The last thing, how do you see the future going for India over the next few months? What do you think is going to happen?
You're asking in the number of cases?
No, just how do you feel? What sort of direction is India moving in at the moment? Are you worried?
Yeah, definitely. But people are searching the medicines. See, vaccine we don't know when come, but people are working on the treatment part. So if people are having COVID-19, they can be treated very well and they can be fine.
But we haven't got we haven't got the treatments yet, not effective treatments yet.
Treatment, yes. People see the percentage of treatment, and people are getting very well in 10 days and 15 days. So the percentage is increasing day by day.
Oh, right, that's good. So the management's getting better. Yeah.
Yes, yes, yes. Day by day, it's improving, but number of cases also increasing day by day.
So you see the infection
But
becoming more
death rate,
prevalent.
uh, yeah, but death rate is very less, so that's a good part because treatment, people are getting good and proper treatment.
Are poorer people able to access good quality treatment?
Yeah, yeah. And in treatment, nutrition and exercise are equally playing important roles.
Yeah. Okay. Shweta, that's very interesting. I love your philosophy to the care here, that you are not giving drugs and supplements unless you need to, and that you
Yeah,
are
so first
you are
priority is
training.
nutrition.
Sorry.
First priority is nutrition. So if
Yes.
I am able to educate people with the nutrition part, then they can keep with their self for long life because nutrition is not for only one day. It's a lifelong habit actually. Good habit.
Absolutely. You're training people how to make the best of the environment they've got, even with very limited amounts of money, that they can still promote good health.
Yes, yes, yes.
Yeah. Wonderful. Dr. Shweta, thank you so much for coming on.
Thank you. Thank you. Thank you so much.
Is
It was really nice talking with you.
oh, you too. God willing, we'll meet one day. But for now, the internet I'll just have to do. So thanks very much, Shweta, for coming on. I'm sure people all
Thank
around the world will find this equally fascinating, and your approach to care equally fascinating as well.
you. Yeah.
And I think completely the right approach. Yeah.
Okay.
Yeah.
Thank
Thank
you.
you. Thank you.
Thank you. Thank you.
Thank-
Bye.